Uh-oh. Hello, friends who have joined on so far. We're just, per usual, going to give some folks some time to join onto the meeting. So just hang in with us for maybe like 2 more minutes. We'll let some more people join on. I can see as they're getting on here. So thank you for waiting. Okay, so we'll go ahead and just get the ball rolling. People obviously can join in. The meeting's recorded too, so if folks want to go back at any point or share it with the stakeholders that they have or friends, community, whatever it may be, you also are free to do that because the video will be posted to the Senate Democratic web or YouTube page. However, we will go ahead and jump right into it and start with introductions. So I'm Senator Ingram, Senior Legislative Aide. My name is Deja. Senator Ingram is going to be joining on, however, she has some business she's dealing with in Cincinnati right now. And then Senator Ingram's co-chair of the caucus, along with Senator Paula Hicks Hudson, another co-chair of the caucus. Senator Hicks Hudson also has an event in her district today, getting some information out to her constituents. So her staff's going to be joining on the call. And then graciously today, we are joined with the Ohio Birth Center and Cole Ramsey. They are the organization's education and outreach coordinator. And so they are here today to talk to us a little more about freestanding birth centers specifically, and their role here in Ohio and how that works. So thank you to everyone that has joined on today and joins our meetings pretty frequently. And Cole, thank you for being here today to present on this important topic. And so whenever you're ready to get started, please feel free to go ahead.
Fantastic. Thank you. Thank you so much, Deja, and Senator Ingram and Senator Hicks Hudson for championing birth centers in Ohio, and for everyone who's on this recording for being here. I deeply appreciate all of your time, efforts, and energy. So yeah, I'm gonna go ahead and dive in. Feel free to, drop questions that you have in the chat at the end. If I see something that like pops out, I will try to address it, but there is room at the end for answering questions. So yeah, just know that that's available. I'm going to go ahead and dive in. Today we're talking about expanding access to care, Ohio's need for freestanding birth centers. As Deja said, my name is Cole Ramsey. My pronouns are they, them, theirs. I am the Outreach and Education Coordinator for Ohio Birth Center. I have been a birth and postpartum doula trainer, childbirth educator, lactation professional, and parenting educator serving Central Ohio and as a trainer across the country since 2003. So I have a little bit of experience here, and I'm super passionate about birth and expanding access to birth options, which is why I work at Ohio Birth Center. I had to retire as a birth doula as I'm disabled, and I can no longer attend births. So I am so thankful that Ohio Birth Center exists because it provides an accessible job opportunity for me to continue in my chosen field. Ohio Birth Center is Central Ohio's first and only freestanding birth center. We opened on January 30th, 2024. We are currently able to provide well body care or well woman care. We're also able to provide prenatal services. And we are unable to do births here at the center because we are not yet licensed. In lieu of that, we are offering our clients the option of a home birth until we are able to be licensed, but that is not our goal. Our goal is to be doing births here at the center. We are accredited by the Commission for the Accreditation of Birth Centers, and I'll talk about them in a little bit. And as I mentioned, we are not yet licensed by the state of Ohio. Our licensure application has not been denied, but our request for a waiver for transfer agreements, which we will talk about, has been denied, which is preventing us from providing expanded services. Cincinnati Birth Center, who is not we are not affiliated with Cincinnati Birth Center. We are in community together, but we are not business affiliates. They are facing the same hurdles that we are, and we'll talk about that in a little bit. Ohio Birth Center only.
Hey
Not
Cole, sorry, not to interrupt you, but I didn't know if you were trying to share PowerPoint or because I think you just have to pull that up. I just wanted to, before you got too into it, if you didn't realize.
I did not.
But if you
Thank
want
you.
to pull that up, you're welcome.
Um,
It should be like share screen. I don't know if you're on your
yeah, I
computer.
thought I was sharing. Stop share. Let's try that again.
Okay, there we go.
My bad. Thank you
That's
so much.
that's okay. Thank you.
Yeah. Okay, this is much better. And you guys, can you just see the normal PowerPoint, not my notes?
Yeah, we can see the PowerPoint. Mhm.
Great, thank you so much. We opened on January 30th, like I said. We are owned by Birth Partners, Inc. Birth Partners, Inc. was founded in 2014 by Laura Wiegand right here and Dr. Deli Ogunley. And Dr. Deli did his first round of medical school and residency in the UK, and then he came here to the States and did a second residency at Good Sam in Cincinnati, where he also started the first certified nurse midwifery program in Cincinnati. He then moved to Illinois, where he opened his very first birth center. Birth Partners Inc. or BPI own 7 other birth centers in 6 different states, and they are committed to increasing access to quality midwifery-led care through freestanding birth centers. Nursing, now this isn't working. Okay. You can see Birth Partners Inc. owns 3 birth centers in Illinois, 1 in Indianapolis, 1 in North Carolina, 1 in Florida, and 1 in Oregon, in addition to us. They have never in their history had the issues with getting licensed that we are having here in Ohio. And I think that that's an important note. Ooh, I swear I do know how to use technology. Birth centers are a high value option for maternity care, and birth centers complement the existing hospital-based systems. Care that is provided by birth centers fully meets the triple aim vision of healthcare. We improve the experience of care, we improve health of populations, and we reduce per capita costs of health. Before I get into what we are, I'm going to talk about why we matter. First of all, birth center care has been shown to reduce this primary cesarean birth rate by 60%, and we reduce the overall cesarean birth rate by 40%. We also see a reduction in the leading causes of infant mortality. We see a 26% reduction in preterm birth and a 56% reduction in low birth weight. And both of these are the second leading causes of infant mortality here in the state of Ohio. Also, research shows, and this research was done by the Centers for Medicare and Medicaid Services, that birth center care completely eliminates racial health disparities. Side note too, March of Dimes just released their latest report cards. Ohio has a D+ when it comes to preterm birth, and we rank 43rd worst infant mortality rate in the country. In addition to improving outcomes, we also save money. The average cost for birth is 21% lower at birth centers compared to hospitals. And the average cost of care for the birthing parent and the baby is 15% lower in the first year of life after birth for birth center clients compared to hospital births. I think it is also really important to note that outcomes are improved regardless of where a person ends up giving birth. So even if someone risks out of birth center care during their pregnancy or during labor and birth, they still tend to have better outcomes than people who receive traditional medical care. The state of Ohio, Ohio Birth Center alone has the potential to save the state of Ohio $1.4 million. Columbus, in and of itself, the population that we have here, Columbus can support up to 4 freestanding birth centers who are doing 300 to 350 births a year. If each birth center is doing that number of births a year, in Columbus alone, we have the potential to save the state of Ohio around $5 million every year. So that's a pretty significant number, and that's just Columbus. So what are freestanding birth centers? Birth centers offer a home-like setting where certified nurse midwives provide family-centered care during low-risk pregnancy, birth, and the postpartum period. We are specifically designed for people who are seeking a physiological birth experience or an unmedicated birth experience. Hospitals are designed for the most high risk of birth, and that's what they have to center and be ready for. We center low risk birth, and we are designed explicitly to take care of people who are seeking a very specific type of birth experience. 85% of pregnancies are low risk, and birth center care is evidence-informed, trauma-informed, and inclusive of all birthing families. When birth center care, when we talk about being inclusive, we don't just mean people like me. We mean everybody. We take our time, and not just us at Ohio Birth Center, birth centers in general, take their time to get to know their clients. We spend 60 minutes with our clients at their first prenatal appointment, and all of their other appointments are a minimum of 30 minutes in length. This is compared to the average of 5 to 7 minutes that most people get with an OB during their pregnancy. By the time we have had our 3rd prenatal appointment with our clients, we will have spent more time with them during their pregnancy than their OB would during their entire pregnancy. All of the care here at the birth center as well, we are able to do ultrasounds, we do lab draws, we have very strict requirements for the type of care that we are able to provide here at the center. In Ohio, there are 2 different types. There's actually 3 different types, and we'll get there. But there are alongside birth centers, alongside units are attached to a hospital. They are integrated into the hospital system because they are owned by the hospital. Ohio has 1 alongside unit, and that's Family Beginnings in Dayton. And then there are freestanding birth centers, which is what we're here to talk about today. Freestanding birth centers are standalone facilities that are in close proximity to a hospital. Ohio Birth Center is, we are open. We are the first and only in Central Ohio, but we are not yet licensed. Cincinnati Birth Center is in Cincinnati. They are also open and have been denied their licensure application by the state of Ohio. So they are in the same boat we are. They are able to provide prenatal care, but only able to do births at this time. Cleveland is about to get a birth center. We're so excited. I am so thankful for the work that Birthing Beautiful Communities has been doing in Cleveland. They are about to break ground, I believe, if they haven't already. They've been doing great work up there for a really long time. So they're going to be successful, and I'm really excited for them. And then Ohio also has this thing called exempt birth centers, and we do have multiple exempt birth centers, which I'll get to in just a moment. Um, it is very important that birth centers receive accreditation through the Commission for the Accreditation of Birth Centers. This is an organization that sets the standards for birth centers nationwide. I'm sorry, not our medical director, our midwifery director, Renee Yeager, she comes to us from Arkansas, and she was a midwife at both a large tertiary care setting like OSU and in a small community rural hospital. And her experience going through the CABC accreditation process was that it was the most rigorous accreditation process she has ever been through. She has never had to show as much documentation and evidence of our safety procedures than she has had going through this. So I thought that that was really interesting and something worth noting. It is important to note that both the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine both recognize accredited birth centers as a first line of care for low-risk pregnant people and birth. Society for Maternal Fetal Medicine, by the way, are the high-risk OBs. So Ohio has two distinct categories for birth center. The first is exempt birth centers. Exempt birth centers are owned and operated by a religious entity, and they provide services exclusively to women who are members of that religious denomination, and they are exempt from licensure. They have different requirements, but they are exempt from licensure, including the requirement for a hospital transfer agreement. And then we have licensed birth centers, which is what Ohio Birth Center, Cincinnati Birth Center, and anyone who wishes to open a birth center in Ohio falls under this category. Freestanding birth centers or birthing centers are licensed as healthcare facilities in Ohio. The rules for birthing centers are set forth in Chapter 3701-83 of the Ohio Administrative Code, and you can see the rules there. Ohio has no licensed freestanding birth centers due to the laws that are currently in place. Specifically, the requirement for a written and signed transfer agreement. And this is something that creates a major barrier to opening and maintaining a birth center in Ohio. It is important to note that while the American College of Obstetrics and Gynecology and ACOG and the Society for Maternal Fetal Medicine say that we should be working with birth centers, it doesn't necessarily include needing a signed transfer agreement. This is a map of birth centers across the country. You can see that Ohio, we have one listed here because of the alongside unit in Dayton. There are 3 exempt birth centers in Ohio, and there are no freestanding birth centers. The freestanding birth centers that used to exist in Ohio all had to close due to the requirements for the transfer agreement. States that do not have this requirement for a signed transfer agreement have birth centers. States that do not have this, that do have this requirement, do not have birth centers, and this is very easy to see here on this map. ACOG and Society for Maternal Fetal Medicine say to ensure optimal care of all pregnant women, all birth centers and hospitals should collaborate with care and develop and maintain maternal transport plans and cooperative agreements. Collaboration is essential. We need hospitals. Hospitals are important. And we are so thankful for them. The underuse of interventions is just as harmful as the overuse of interventions. And it's so important that we be mindful of these things. We respect hospitals. We are so thankful for them. And not everyone needs to be in a hospital. Written contracts and agreements with transfer hospitals reduces access to birth center care when hospitals refuse to enter into such contracts and agreements. And vital statistic data show that states with this requirement have fewer birth centers than states that without this requirement. Hospitals should be expected to coordinate or cooperate in planning, and it is expected that they not place barriers in the way for safe transitions. And we don't need a contract for hospitals to take our transfers. And the reason for this is EMTALA. So EMTALA is the Emergency Medical Treatment and Labor Act, and EMTALA is a federal law that requires hospitals who accept Medicaid to care for anyone who arrives at the hospital with an emergency or if they are in labor. Um, so hospitals are already legally required to take our transfers. And by asking them to sign a piece of paper that says that they will follow the law, it prevents birth centers from opening. Um, no Central Ohio hospital is willing to engage in a written signed transfer agreement with Ohio Birth Center. They have all said they are more than happy to take our transfers. They are more than happy to be available to us. And they are unwilling to sign a piece of paper that says that they will do so. Cincinnati Birth Center is in the same boat. I do want to call out Birthing Beautiful Communities in Cleveland. They have been doing really incredible work in their community for a long time. And they do, even though they're not built yet, they do already have a transfer agreement in place with Cleveland Clinic. I do want to note, though, that Cleveland Clinic is a little bit more forward facing, especially over Columbus when it comes to midwifery care. And Cleveland has really been leading the way when it comes to midwifery care and improving outcomes in birth. So shout out to Cleveland if anyone here is from Cleveland. Hospital transfers do happen, and that is a concern for people. And so I do want to address that. And again, I want to re-emphasize that research shows birth center clients have improved outcomes regardless of where they give birth. About 12% of our clients will transfer care during the course of labor. The vast majority of hospital transfers are for pain relief or prolonged labor. And 2% of the 12% are transfers for emergent reasons. To give you real numbers for us here at Ohio Birth Center, this is going to equate to about 2 to 3 transfers for emergent reasons per year. I also want to call out the reason why I mentioned that Renee, our director, had worked in a small community rural hospital. She actually had less access to resources at the community hospital that she worked at than we do here at Ohio Birth Center. Her anesthesiologist, her OR team were 30 minutes out from the hospital. And they were doing inductions there. They were doing things that we are not able to do here at the birth center. We are only doing unmedicated birth for low risk pregnant folks. Due to us not being able to get licensed by the state, we have been in operation for 10 months. We opened on January 30th. Over 300 people have been unable to access our care. And this is because without being licensed, we are unable to have insurance contracts or contracts with Medicaid. So our care is inaccessible for people unless they have insurance that allows for out-of-network coverage, or if they are going to pay out of pocket. The out-of-pocket cost for birth center care here at Ohio Birth Center is $8,000. That is inclusive of all prenatal care, all standard labs that are done during pregnancy, 3 ultrasounds, a wrap-up class that all of our clients have to take in order to give birth with us, labor, birth services, and then 4 postpartum appointments as well. So that is an inclusive package that includes everything that our clients need to receive care here at the center. But like I said, over 300 people have sought care here at the center this year that we have had to deny care to. We've also not been able to hire over 10 people as well. We have people who are waiting to be hired, who are so excited to work for us. Everyone from office staff to midwives to nurses. We are being limited on who we can hire until we are licensed. advocating for birth centers is essential, and that's what we need all of you to do. Research shows that when people advocate for birth centers, we get change made. So the ways that you can advocate for the birth centers in the state of Ohio are to vocally and publicly support us, especially the ones in your area. Um, help us with conversations with hospitals if you're able to do that. But just giving us public support is so important. Also, Senator Ingram and Senator Hicks Hudson and many other senators have introduced Senate Bill 322, and we would love your support behind that. I know I talked really fast and I gave a lot of information, and I know we still have quite a bit of time, and that's intentional on my part because I know that people tend to have a lot of questions about all of the things I just talked about. And so I want to make sure I'm giving you ample time for that. Also, I do want to go back because I think I forgot to call out a few things about just our ownership. I got distracted because of the sharing screen thing. So Laura Wiegand right here, she is one of the founders of Birth Partners Inc. and Ohio Birth Center. This is Dr. Ahmad. Dr. Ahmad is, I don't remember what kind of doctor he is actually, but he is one of our primary investors and part of our leadership at Birth Partners Inc. Ariel Swift here works at Birth Partners. Dr. Deli Ogunley is our medical director here at Ohio Birth Center. And then he's also the CEO and founder of Birth Partners Inc. And then we have Dr. Dapo here. Dr. Dapo is a nephrologist, also one of our investors, and is deeply rooted in birth center care. The other staff that we have here, we have Jalea Fitzgerald. She's one of our certified nurse midwives that we have on staff. This is Renee Yeager. She is our director of midwifery here at the birth center. And Audra Phillips is our office manager. And Audra is a retired home birth midwife, and she's been serving Central Ohio families for 20 years in the capacity of a home birth midwife, and is excited to no longer be on call and still supporting birth here in Ohio and in Columbus. So yet another accessible job option. I'm gonna stop sharing my screen because I find that overwhelming. And I am here to answer questions.
Yeah, thank you so much, Cole, for that wonderful presentation. Sorry, my phone. I think that was very informative, and I do see we have a question in the Q&A, so I will go ahead and read that off for everyone, and then you can take a stab at it. So, one of our attendees says, are hospitals not signing transfer agreements because they may think that they stand to benefit financially, or do they think that they improve safety by keeping it all in-house, thus incentivizing births at freestanding birth centers?
That's a really great question. So Dublin Methodist Hospital was the first hospital that we spoke with. They actually initially said yes, that they would sign a transfer agreement with us, which is why we started construction. And then when we were nearing completion, we went back to them to finalize things, and they said, sorry, we won't sign a transfer agreement. But we will take your transfers. We just won't sign something. They did not give us a reason. We did not get a reason until we went to St. Anne's. And St. Anne's administration initially was very enthusiastic and very supportive. They really love the model. They appreciate what BPI is trying to do. And ultimately, we were told that they had to decline because the OBs at the St. Anne's said that they would no longer take their patients to St. Anne's, and the OBs threatened to walk from the hospital. We then went to OSU. OSU said, maybe, but it's the state and it takes a while. Tara, I'll get to that, Tara, yeah. the Ohio State said maybe, but it takes a while. And then, to be honest, they just stopped responding to our emails. We then went to Memorial Health in Marysville. They're the only independent hospital in Central Ohio, and so we thought that maybe they would be more understanding. And again, they were phenomenal. The administrator there was super supportive. She was really excited because she wants a NICU at Memorial Hospital, and she felt that having a transfer agreement with us would actually help them to get their NICU. Ultimately, the 4 OBs who go to Memorial Health said no. So it is the OBs in the city who are blocking the hospitals from signing these transfer agreements. I have called every single OB office in the city and asked to answer any questions or concerns that they have. And they have all declined our offer to answer questions and concerns. Midwives, and I'm only speaking for Columbus because this is where my knowledge base resides. Midwives in Columbus have historically been looked down upon by OBs. And there's even a broader historical context for this that I won't get into in this call, but yeah, there's a broader historical context to OBs preventing midwives from operating that also have some racial undertones, and not always undertones. Blatant racism is involved in that sometimes as well. I hope that answers that question.
Yeah, well, real quickly, like while we're on the topic of this question, I actually had met with some OBGYNs. Well, Senator Ingram and I, they had met with us, not necessarily talk about this topic, but just a meeting in general. And I did bring the question to them about this kind of issue with, the OBGYNs, like how does this like impact them, and kind of what maybe if they had any, I don't know if they specifically as OBGYNs had experience with this, but if they've heard talkings or have seen it happen in the field, maybe why there's like this resistance. And just if you can expand, because when they explained to me, they kind of said that sometimes with the transfer agreement, from what they've seen or heard about, is that when they people reach out and they're asking like a specific hospital, that one of the scenarios was that for that specific hospital was that the staff in, let's say, the maternity ward per se, has like rotating individuals, or like maybe there's different types of people who are employed, the residents there, like stuff like that. And so their concern, from what I heard, was that if they were to sign, I don't know necessarily the particular language of what the transfer agreement looks like, but from my understanding and what they explained was that if the language says like this specific group of people or this individual, this doctor is going to take this patient, that it could put the hospital at risk because that doctor might not always be there because of the way they have their staffing situation. So I'm just wondering, I'm curious if that is something that like is a part of what you're talking about in terms of that.
How does I will answer that question before this person has to hop off. How does Cleveland have an agreement? Birthing Beautiful Communities has been doing such deeply entrenched work in Cleveland. And again, Cleveland Clinic is ahead of the game when it comes to birth and when it comes to expanding birth access and options and care. Cleveland Clinic is just really light years ahead of the game. When I would travel as a doula trainer to other cities, I remember doing a training at Mayo Clinic and someone was like, "Oh, you're from Columbus. I'm so sorry." It was known. So to go back to Deja, what you were asking, so the hospital transfer agreement does not specify that a doctor has to receive our clients. That is an option. There's an option for a variance. If a hospital will not sign on, there is an option in Ohio for a variance. And ODH doesn't actually tell us what the requirements for the variance are until we apply for it, and then they deny it. And then they tell us what the requirements are. So the requirements for a variance are that we have to have 4 OBs who are willing to take 24/7 call for our clients. And in that case, yes, that doctor would have to be on call in order for a hospital to accept our transfers. Our argument is that it is not necessary at all because hospitals are already legally required to accept anyone who shows up at their door in labor. And so if a person decides that they're just going to have a home unassisted birth without any midwife, without anyone present, but then realizes during the course of labor, and they might not have had any traditional prenatal care, and they realize during the course of labor, oh, I need to go to the hospital, they can just show up at the hospital. They don't have to have a doctor on record. They don't have to have anything. The hospital has to provide them care if they're in labor. That's why EMTALA exists.
Right.
So hospitals should already be prepared for any emergency that shows up at their door. And while we don't believe that a transfer agreement is necessary, that doesn't mean that we don't want to collaborate with the hospitals. It is so necessary and important for patient safety to have transfer plans in place. We have a wonderful working relationship with Columbus Fire and EMS for when those transfers have to take place. We also have a wonderful relationship with Columbus Nationwide Children's and their NICU department. Their NICU transport team and the head of the NICU came here to the birth center, and we had some really amazing conversations, and we are in collaboration with them to ensure the highest outcomes.
Yeah, and sorry, not to cut off other people, but just on the last note of this kind of topic, just because we did have this conversation with the OBGYNs, and I appreciate the clarity on that, because that was something we were trying to figure out is what language has to be in these agreements and what kinds of agreements, and something that they had suggested, and not in lieu of, but just in regard to like verse, if I asked them about how they feel about the transfer agreement, and I guess something that they, at least from their personal experience, maybe not to the whole everyone else, but their concern, or like they would be okay with, is just ensuring, like you said, like having the, on behalf of the birth center, their transfer plan, at least, even if there's not the agreement, but so when the person does arrive to the hospital, like setting that person with like full documentation of like everything that they've been dealing with, like at the birth center, history of whatever, medicine or blood. So I think that from when we specifically spoke to those individuals, they were like, to me personally, they're like, yeah, we can't deny a patient. So if they're coming from a birth center and like at least having those records sent with them, then like that, I mean, you can't deny a patient. So just
That's what we do. Yep.
Right.
So when a hospital transfer is initiated, we call the hospital, we let them know, because we are doing home births. So we have already had some hospital transfers from home birth. So our process for hospital transfer is we call the hospital ahead of time. We let them know that we're coming. We fax over the client's medical history and medical file so that they have the full medical record, including all of the labs, everything that was done during the pregnancy. When we arrive at the hospital, before we arrive, we give them a report over the phone as to what's coming in. And then when we arrive, we give report. And we stay with our clients until they are stable and a plan is in place.
Okay, thank you so much for that clarity. So I'll go ahead and get back into these questions.
Yeah.
Tony Overly asked, will there be doulas directly on staff for the birth center once it's actually able to start serving births?
Yeah, that's a really great question. The short answer is no. And we strongly and heavily encourage our clients to hire doulas. It is not a requirement because we recognize that doulas are not always accessible. And so we don't feel that it is okay to make that a requirement. But we do strongly and heavily encourage it. The reason why we don't have doulas on staff here at the center is it is extremely important for folks to hire a doula that they feel safest with and the most comfortable with. And they're forming a more intimate relationship with that person throughout their pregnancy. Once we are full staff, we will have 5 midwives on staff, and our clients get to know each midwife throughout their pregnancy, but they don't have any choice in who is on call and who will be at their birth. And when they hire a doula privately, they know that that person is going to be there, or that the backup who they have likely met will be there. So it's really important to us that our clients do have doulas, but we want them to have options and who those doulas are. We also really want doulas who will labor at our clients' homes before they come here to the birth center, which makes it a complicating factor if doulas were employed by the birth center. But we strongly encourage doulas, love doulas.
Do you all do any type of, because maybe you have a patient coming in who might not know what a doula is, do you all like um at least get resources to them to be like, hey, have you ever heard of this?
Oh, yes, yes. So in order, before someone can even start birth center care here at the birth center, they have to take a tour. And the tour is more like an orientation. And we start talking about doulas from day one. And we have conversations about doulas and several of the prenatal appointments. All of our first-time pregnant families have to take a childbirth education class that is geared towards unmedicated birth. I teach our classes here. It doesn't have to be our class, it can be anyone's, but if they take our class, I definitely emphasize the role of doulas there. We strongly advocate for our clients to get doulas, and we would make it a requirement if doulas care was more accessible.
Thank you. And so the next question we have is from Tara, and it says, are freestanding birth centers considered ambulatory surgical facilities? And if you want to explain what that kind of facility is too.
Yeah, so that is part of the issue. We are our own category. So an ambulatory surgical facility is our freestanding facilities that do surgical procedures. And this is where the requirement for a transfer agreement comes in. We are not actually under that category, but we often get lumped into that category because I think some of our rules are there, but not all of them, which makes it confusing. But we do not do any surgery here at the birth center. The only, the most advanced surgical, and these are not surgical, the most advanced things we do are suturation of a tear from birth, and placing an IUD or placing some type of implanted birth control. That is it. We don't provide any other, we don't do circumcisions, we don't do anything that makes us an ambulatory surgical facility. Birth centers are not surgical facilities, we're birth centers.
And then I just have well, it's a shout out from Representative Adam Holmes. Yesterday, we did pass here in the Senate, House Bill 497 or 479, which is bringing awareness to stillbirths, because that's, obviously a big issue here in the state across our nation. So just wanting to reemphasize like the intent that we're trying to push here at the State House to raise awareness and advocacy, especially in bringing in our men and other folks who just might not be aware of like the life-saving work that doulas do, that birth centers do, and just having all these options in a person's birthing experience to just better improve the overall outcome, because that's the goal. And so thank you, Rep Holmes. And Tara just says thank you, and that they were reading the code and just trying to kind of work through this as we discuss.
Yeah, Rep Holmes, if I can offer too, thank you, thank you, thank you. And I love that you're saying that your intent was to raise awareness and advocacy in men who might not be aware of doulas, because men, fathers, husbands, partners, like they are so important. And they are also going through a life transforming event. No, they are not pregnant. No, they are not pushing a baby out. And they are becoming a father. And that is a huge life changing, life transforming event. And they deserve support. They deserve love and care and to be held and seen and supported just as much as women do in birth. And I like to say that doulas allow men to be the father and the husband, and we take the pressure off of them to be the coach. I think it's really unfair. Men have only been part of birth really since the 1960s, and they have all of this pressure on them to be this perfect support person when they themselves are experiencing an emotional event. And they deserve love and care in that too, which is why doulas are just so beneficial. We support dads, we support the birthing mom or birthing person. We support the whole family. And dads do not have enough support, and they deserve more. I mean, no, parents in general, let's just be real. Parents in general do not have enough support. So yeah, just as quick side note, anthropologically speaking, as human beings, we are supposed to have 4 adult caregivers for every 1 baby. And 3 of those 4 caregivers are supposed to be capable of feeding the baby. And so, our families are really struggling because they lack that robust support and village that our brains are hardwired to expect.
Yeah, no, definitely. And I appreciate all of that. And so if anyone else has any other questions, please feel more than welcome to throw them in the chat and and if anyone on the call has questions, you can always follow up after this. I'll send out a follow-up email. You can always email our offices, Senator Ingram's office, Senator Hicks Hudson, and we can always direct questions over to Cole as well, and get those answered for you. I just had one more question for you because we obviously have a lot of people that come to the State House. Senator Ingram meets with a lot of individuals, and especially on the topic of infant mortality and maternal mortality and reducing that in the state of Ohio. And so something I would like, if you're able to, is kind of talk about, the difference of we might have like maternity wards, or maybe at the hospital there is like a not necessarily a birth, it is like a birth center, maybe they do have the tub or something, but the difference though of that versus something like this, and also just the dynamic that right now in the state of Ohio we have maternal health care deserts where there's nothing available. And what if a birth center could be that alternative option for the
Yes.
people that are living in those regions that don't have any access at all to birth care and might have to drive, like you said, 30, 40 an hour away just to access their, prenatal care, postpartum care, all that kind of stuff. So
mean, we have people right here in Columbus who come to us, come to a tour, and they are 5, 6, 7 weeks pregnant, and they are telling us that they can't even get in to see the OB that they have been seeing for 10 years until they are 15, 16, 17 weeks pregnant. Like this is their provider that they've been seeing, and they can't even get in for care until they are out of the first trimester and well into the second trimester. That lost care opportunity in the first trimester, there is so many things that are happening in the first trimester that pregnant people need care for, and that folks in Columbus can't even access their OB until 15 weeks is a problem. Um, Ohio needs more providers, not less.
exactly. And I think, as we continue to have these conversations, I think that's like the main point across the board with access to healthcare, period, is that it takes a collaboration across all, facilities and like types of care that's being offered to be able to improve all overall health outcomes for all
Yes.
Ohioans. And so I think that, again, just having those options in birthing, I mean, if that's our goal to reduce these disparities we're seeing, then, just working towards that kind of collaboration and accepting that, you know, going to your primary care physician or having like the chiropractor, all these different, I don't know, just people across the board to improve health outcomes. And so we have another question from Tara, and just asking to you and to the group, what are the key advocacy steps that we could take in the next GA to kind of sort through these regulations, and especially in a bipartisan manner because it impacts us all, just to increase access to maternal health care? I don't know if you
Yeah,
have
I think
suggestions, but
yeah, it's a great question. I would say, you know, I have been talking to a lot of Republicans, and we do have bipartisan support for getting us open. Um, Unfortunately, pardon me, I'm not sure why none of the Republican senators signed on. We have been having a harder time on the Senate side, I will say. We have a lot more House Republican contacts. Um, the thing I say to everyone is that everybody is born and everybody gives birth. Birth is a bipartisan issue. And everybody deserves to be cared for with respect and dignity. And every baby coming into this world also deserves to be cared for with respect and dignity. And that is what we are trying to accomplish. And, birth centers appeal to everyone. Because everybody gives birth. Anyone who is seeking an unmedicated birth experience, like a birth center is the place to be. I have attended over 220 births in Central Ohio, and we have needed a birth center for as long as I've been in existence as a doula. I have seen horrific things take place at the hospital when people are just asking for something that's different than the standard model of care. They're not asking for anything outlandish or anything. It's just different than what OBs are used to providing. And the common perception is different equals bad, but it's not, it's just different. So yeah, key advocacy steps would be talk to your Republican colleagues. Let's see if we can get this bill. I mean, if we can get it through this lame duck session, that would be incredible. I think I'm not sure if that is an option or not, but we do plan on, we would like to get this reintroduced at the beginning of next year. I will be very honest with you. If we cannot get this legislation changed, and if none of the hospitals are willing to give an inch, we will close. We will not be able to sustain doing home births only. We just can't. And this is the primary reason that every freestanding birth center in Ohio has ever closed, is transfer agreements. This is the primary hurdle to opening and sustaining a birth center. The secondary primary hurdle just across the country is financial support, and we have the financial support of our parent company. They have a proven track record of successfully operating birth centers. So that hurdle is covered. The biggest hurdle right now is transfer agreements.
Thank you so much, Cole, for all of the insight that you've been able to provide to everyone today. It's always invaluable to hear from people who are directly there doing that work and getting the perspective of people across the board. And we're all here working together again on the same goal, just birthing healthy babies, having healthy families, and just having the ability to have a choice in what kind of care you would like to receive. So I think that's so wonderful to have you today. And I don't know if anyone does have any more questions. I know we're kind of coming up on the 1 o'clock hour. So if anyone has any additional questions, do not hesitate to reach out to Senator Ingram's office, Senator Hicks-Hudson's office. I will follow up. And the recording won't be available right away. We have to sort that out, but it will be available. And I can also share that with everyone once we have it. I'm just going to make sure I'm not missing anyone's questions. And then just to throw a bone out there to everyone, we are in the process of planning a big advocacy day around maternal and infant health here in the state of Ohio come April. That's going to be Minority Health Month, as well as Black Maternal Health Week falls in the month of April. So we'll be inviting folks across the state who are doing this work in a variety of capacities to join us at the State House, be able to talk to their representatives, to their senators, to just spread more awareness on the work of infant and maternal health. And so we're hoping that'll also just be that advocacy tool that Tara had brought up. That's something we're looking forward to getting sorted out. So those details will hopefully be going out before the end of the year. But yeah, so I guess we can wrap it up here. And again, thank you so much, Cole. Thank you to everyone who took time out of their Thursday lunch hour to listen in. And yeah, I don't know, Cole, if you have anything else to say, feel free, but thank you all
Yeah.
so much.
I just want to say thank you one more time. You all are so appreciative. Your time and effort and energy matters so, so much. And I really deeply appreciate that you took your time out for us today.
Thank you all again, and I hope you enjoy the rest of your Thursday afternoon and the upcoming holiday season. So thank you all so much. Have a good rest of your Thursday.